function of the brain. Broadman high scientist neurosurgeon, okay? Separated of the whole of brain, 52 part of the Broadman area, okay? Broadman, very high scientist. Broadman, high level scientist, neurosurgeon, okay, all of brain function, this is this part function of the brain separated of 52 part, okay, name is Broadman area. Broadman area, this part primary motor area. Primary motor area, prefrontal, this part, prefrontal part, okay. Primary motor area, Broadman of 4. All of function, primary movement, primary heighting, okay? And another part, premotor 6 Broadman. And here, prefrontal contains 3 parts, 1, 2, 3. Upper part, this part, 2 parts, frontal eye field. This part, frontal eye field. Okay, frontal eye field, gazing, or movement, frontal eye field. But visual, posterior part. Movement, heavy, okay, movement, heavy movement, function of frontal. But this red and red below, okay, visual, posterior part. Or gazing, what's the name? Gazing, خیره شدن. Okay. Gazing part, frontal. Which area of frontal? Middle, frontal, frontal area. Okay, frontal eye field area. And this part, Broca area. Broca area, pronunciation. Okay, talking. This area, injury. What's the main injury? Okay, damage. Okay, damage, trauma. This trauma, aphasia. Okay, talking, very, very difficult. Okay, this part, Broca area. This part, Wernicke area. Wernicke area, anarchist of typing. What's the meaning anarchist? Typing, high level, low level typing. Okay, unknown, typing unknown. Okay, maybe. Typing no, okay, damage this part, unknown, okay, typing. Repeat.
Damage to the Wernicke's area causes
unknown. This part, which part? Wernicke area. This part, sensory. Okay. All of lateral wall of hemisphere, finish. Okay, and another. Okay, did you understand this part?
Yes.
Okay. Another part, medial surface of the brain. Okay, medial surface. Medial surface formation from any structure. Corpus callosum. Phrase corpus callosum. This corpus medial. Medial one of a hemisphere. Medial. Medial one of hemisphere. Okay, medial one formation from corpus callosum. This one corpus callosum. Corpus callosum contains any part. One rostrum, two part genome, three part body, four part largest part, splenium. Corpus callosum contains any part anterior to posterior contains four part, 1, 2, 3, 4. Rostrum, genome, body, and this part. Thalamus. Okay, medial var thalamus. Thalamus. Interthalamus, interthalamic adhesion, sulcus, hypothalamus, epithalamus, metathalamus, subthalamus. Okay, all are medial part. And this one, anterior commissure, and this part posterior commissure. Okay, posterior commissure. And another part, corpus callosum, this part, corpus callosum, and this part septum flacidum, septum flacidum, singulare sulcus, singulare gyrus, internal frontal gyrus, or medial frontal gyrus, this part, supplementary motor area, medial surface, supplementary motor area, this part, motor area, supplementary motor area, sulcus, calcarine sulcus, sulcus, calcaneus sulcus, location of posterior occipital lobe contains the visual area, this part, visual area, visual area sensory part, but eye field motor area, motor part, eye field motor, okay? Because, okay, movement, gazing, okay, but visual posterior part, this part, visual part, 17, 18, and 19 broadband area. 19 broadband area. 7, 8, 19 broadband area. And the palliato-occipital, this part, palliato-occipital sulcus. Okay, this part conus gyrus, and preconus gyrus, conus gyrus. All of structures of the medial wall of the hemisphere. Okay, all of structures which were part of the visual area around of the calcarine sulcus, 17, 18, 19, segment of the Broadman scientist, neurosurgeon scientist, separated of the all of brain, smallest part. This is part visual, this part Wernicke, Broca, aphasia, movement, primary movement, okay? And medial surface, anterior commissure, posterior commissure, and thalamus, epithalamus, corpus callosum, okay? Finished, and inferior surface of the inferior surface. Any question? Surface, medial surface is part, thalamus, this part, parahippoccampus segment, and this is this one. Hippocampus, medial, hippocampus, hippocampus, campus and hippocampus, and this is this part. Dentate gyrus. Dentate gyrus formation from hippocamp. Dentate gyrus. Dentate gyrus. Dentate gyrus. And the anterior commissure, posterior commissure, corpus callosum. This part. Lamina terminalis, lamina terminalis. This part of the frontal septal area, mammillary body, thalamus. Okay, mammillary body. This one mammillary. Body. Septal area contains two sulcus, superior sulcus, anterior sulcus, okay, and posterior sulcus. olfactory anterior, para olfactory sulcus posterior, para olfactory sulcus anterior, okay, and posterior. Between of the anterior and posterior, smallest gyrus, gyrus of the subcallosal. Subcallosal gyrus is gyrus subcallosal gyrus or pro-olfactory gyrus. Another name, pro-olfactory gyrus. Para-olfactory gyrus. This part. All of structures, thalamus, parahippocampal and hippocampal, very important this part. And septal area, medial surface, finish and inferior surface of the hemisphere. Okay, this part. Inferior surface of the brain, inferior. Contains two parts, temporal part, occipital, and orbital. Orbital part contains the sulcus, orbital sulcus, this shape of H, orbital sulcus. Formation orbital sulcus form gyrus, anterior orbital gyrus, posterior orbital gyrus, lateral orbital gyrus, medial orbital gyrus, anterior orbital gyrus, posterior orbital gyrus, lateral orbital gyrus, medial orbital gyrus, and this gyrus rectus, and rectus gyrus, and another part, lateral occipital, lateral sulcus, occipital, lateral sulcus, and collateral sulcus. Lateral occipital sulcus, collateral sulcus, contains two sulcus. Lateral, inferior part contains two sulcus, one of lateral occipito-temporal sulcus and two collateral sulcus. Inferior surface contains three gyrus. This gyrus occipital, temporal, lateral occipital, temporal gyrus, one occipito, temporal, lateral occipital, temporal gyrus, two medial occipito, temporal gyrus, and this gyrus parahippocampal gyrus. parahippocampal gyrus. Parahippocampal gyrus. Gyrus, parahippocampal gyrus. 3 parahippocampal gyrus. Parahippocampal gyrus, anterior part, largest, okay? Big part, largest part, name is uncus. Uncus. Internal of uncus, location of amygdaloid nucleus. Amygdaloid nucleus. Uncus contains one nucleus, amygdaloid nucleus, or amygdala, or amygdala. Amygdaloid or amygdala nucleus. Location, which part of the parahippocampal? Anterior part, then uncus. Uncus. Okay? This part, finish. Inferior surface. Did you understand inferior surface contains things? Lateral surface, medial surface, and anterior surface. Medial surface. Medial surface, calcarine. Okay, medial surface, corpus callosum. Corpus callosum, rostrum, genu, body, splenium. Cingulate gyrus, the cingulate gyrus, cingulate sulcus. Superior frontal gyrus, ya internal, paracentral lobule. Medial part, paracentral lobule, preconus and conus. Conus and conus. Preconus. This part, parahippocampal gyrus, this uncus of parahippocampal. Medial occipito temporalis and lateral occipito temporalis. Inferior surface. Inferior surface. This part, gyrus rectus, and orbital part and temporalis part. Sulcus deep level 1 hemisphere between lobe, level 2 lobe gyrus, and level 3 smallest annex. Sulcus, central sulcus, lateral sulcus, okay, parieto-occipital sulcalcarine and cingulate. Okay, all of sulcus dish and okay, inferior frontal sulcus, superior, no problem, medial. Corpus callosum. In interthalamic adhesion between ophthalmus, corpus callosum, septum placidum, septum placidum, pinal body, posterior commissure, anterior commissure, okay, hypophysis, optic chiasmatic, mammillary body, chiasma, lobe, frontal lobe, parietal lobe, occipital, temporal, insular lobe, location inter of the lateral sulcus, internal, this okay, lobe frontal, parietal, temporal, occipital, the sulcus, frontal, frontoparietal, the sulcus, lateral sulcus or silvius contains 3 parts, anterior ramus, ascending, and the posterior part. Inter of the internal of lateral sulcus, location of the insula. All of lobe, Broadband. Okay, broadband, primary motor area for broadband. And post centralis contain 2, 3, first somatic area and prefrontal A, uncus, 34, broadband area, olfactory cortex, and okay, broadband, primary motor area for the corresponding of the what's the meaning corresponding? Okay, the level of corresponding primary motor area 4 broadband, premotor area 6 broadband, frontal eye field motor area 8 broadband. Okay, Wernicke Broca 44 and 5, and the primary auditory area 41 and 42. This part Wernicke 43. Okay, and the primary visual area as 17, and the second primary area 18 and 19. 18 and 19. This part occipital visual area, primary visual area, association visual area, and clinical. Epileptic seizure, okay, rash epileptic or epilepsy disease. Hemisphere specialization, aphasia, apraxia, okay, and alaxia. All of damage of Alzheimer disease, Parkinson disease, Ras disease, okay, and all of disease of the brain, no cateimini, okay, no problem. Okay, lateralization. No problem. Okay, left and right, global part, analytical, okay, order function. This part global, recognize face, tone and voice, visual spatial skill of very important, right, left and left body side, and musical ability, emotional right hemisphere, but the left hemisphere language, very right language, right hand, right body, time, okay, and right visual, Broca, scientist Mr. Broca. Okay, Broca, very high level scientist, Germany, neurologist of Germany. Karl Wernicke. Right. Function, finish, okay. And another part, basal ganglia and cortex structures. Cortex structures or basal ganglia. Internal structures of the brain hemisphere, internal structures. Okay. The layer of contains covering outer of the brain covering by cortex. Okay, inner covering by white matter. Okay, white matter and gray matter. Cortex, gray matter. Outer, gray matter, and white matter. Gray matter, the same of cerebellum, okay? Two white. Contains any layer, structures, molecular layer, gray matter, contains any layer, molecular layer, two, external granular layer, three, external pyramidal layer, internal granular layer, internal pyramidal layer, and contains 6 layer, multiform layer. And gray matter contains any neuron of the gray matter pyramidal. So, neuron or cell, satellite cell or neuron. 2C4 neuron. Horizontal neuron of Kaja and more cognitive neuron and basket neuron. 1, 2, 3, 4, 5, and 6. 6 neuron, 6 layer. Cortex, internal hemisphere. Hemisphere contains 2 parts. Outer part, gray matter. Gray matter contains 6 neuron and 6 layer. But inner part of the hemisphere all are tract, afferent and efferent tract. All are afferent and efferent tract. Okay. Migration. The layer of gray matter covering intersurface of cerebral hemisphere. Migration of neuron from inner mental layer, embryological layer. Okay, mental layer, embryological layer. Okay. Okay, total surface area, centimeters, weight, no problem, and thickness, not important, this part. And neuron, 10 or 50 billion neuron, and glial cell, large, very numerous. What's the meaning numerous? Many glial cell. Okay, many, but neuron little, okay, glial, pyraneurons, histological organization, pyramidal cell, hot neuron, fusiform cell, basket cell, horizontal cell, Marconi cell, okay, and contains two parts, two gray matter, cortex, and basal ganglia and white matter. Basal ganglia, immigration of cortex and the location deep part of internal brain. Did you understand? Basal ganglia, okay, structures of from of cortex, okay, basal ganglia, okay, structures from cortex. Migration, what's the meaning migration? Okay, movement of migration and enter of deep part of white matter. Location of the white matter. Cortex. Cortex, this was white matter. Okay, basal ganglia separated from cortex and immigration internal of the deeper of the white matter. Okay. This one cortex, gray matter, and separated from cortex, all of neuron formation of the nucleus and immigrate of the white matter. This is white matter. Basal ganglia. Basal ganglia contains any ganglia. Basal ganglia one. Caudate nucleus, basal ganglia, 2. Caudate nucleus, 2. Learn T4 nucleus, 3. Amygdaloid nucleus, 4. Claustrum. All of basal ganglia. Basal ganglia or basal nuclei or basal nuclei. Basal nuclei anatomical classification. What's the meaning classification?
Differentiation.
Okay. Anatomical classification for nucleus. Anatomical. Anatomical classification, but clinical and physiological different. Olaf and subthalamic, right, and substantia nigra and pedunculopoentine nucleus. This part clinical or physiological. Anatomical 4, but clinical or physiological 7. Caudate nucleus and non-T4 nucleus name is stratium. Corpus stratium. Corpus stratium. 2 nucleus. Another name corpus striatium. Corpus stratium. Okay. Corpus stratium from which nucleus? cell, okay, cadet and lentifold. What's your name? Repeat of the formation of basal nuclei from which
It migrates from the cortex to the white matter, and then it's classified anatomically into caudate nucleus, lambriform, amygdaloid, and plastron. And physiologically, there are 7: subthalamic, substantia nigra, and pudendalopointed. And caudate nucleus in lambriform form the corpus transient.
Thank you. Origin from basal nuclei from cortex, cortex, okay, gray matter, okay, and the location, which parts?
In the white matter.
White matter. Which parts of the white matter? Outer part or deeper?
Deeper part.
Deeper part. Okay, deeper part. Did you understand? Okay, all our basal nuclei white matter contains two parts, cortex and basal ganglia. Cortex, basal ganglia, nucleus, the same of cortex. No problem, the same of cortex, but separated and immigrate inter of white matter. Location of inter white matter. Location, white matter. Anatomical classification of the basal ganglia contains 4 nucleus. But you physician, okay, and futures in the clinical substantia nigra, pedunculopointing, and subthalamic, okay, subthalamic damage or injury, which disease? Subthalamic nucleus. Very good. Hemi alasmius. Rodman area, okay. Cyto architectonic, okay, area and association, okay. Repeat. Cyto area and association, okay. From Broadman's number. Broadman number, primary somatic sensory. Location of primary sensory. Location, which part of the hemisphere? Cortex. Which part of the cortex?
1, 2,
Okay, 1, 2, and 3. Location, which parts of the brain?
Posterior.
Yes. Posterior or post-central gyrus. Thank you. Post-central gyrus. Thank you. Very good. Okay. Primary motor area. Primary motor area, Broadman, and premotor area. Okay. Frontal eye field 6. Okay. Primary visual area 17. Olfactory 35. Primary auditory and Broca, expressive speech area. Broca, which part of Broadman?
44 and 45.
Very good, 44 and 45. And this part, cortex. Cortex contains any layer? 6 layer, okay, layer. Outer and inner layer. Molecular layer, external granular layer, external pyramidal layer, internal granular layer, internal pyramidal layer, and multi-pore layer. And okay, neurons. All of the cell of the cortex contains any cell? 7, 6. Pyramidal, satellite, fusiform, caudal, magnetic, basket cell. Okay, and basket cell. Basket cell, pyramidal, fusiform. Very, very important neuron of the cortex, pyramid. Largest pyramid neuron name, beds. Beds. This is the pyramid neuron, pyramid neuron. Okay, largest pyramid neuron name is Beds. Beds, just location, primary motor area. This is neuron, location, primary neuron. What's your name? You?
Me?
Yes.
Adnan. Adnan.
Where are you from?
Pakistan.
You? Come on. Where are you from? Arab. Arab, okay. Beds, which neuron? You?
Five.
Okay. Thank you. Largest primary location, just location, primary motor area, not prefrontal or Broca, Wernicke, absence neuron. This neuron, Bell's largest neuron of pyramid, just location, inter of primary motor area. Okay, location, primary motor basket, and another part. Cortex, isocortex, and allocortex contains two parts, two groups. Cortex contains two groups. Cortex, isocortex or neocortex. Isocortex or neocortex, allocortex or holocortex. Holocortex or this cortex. And the isocortex, okay, neocortex. Neocortex, largest part of the cortex formation from isocortex. And homotypic or heterotypic, this part very important, isocortex and allocortex. Heterocortex, what's the meaning heterocortex? Different. Okay, different. Hippocampus contains 3 layers. Hippocampus contains 3 layers. Outer layer, molecular layer, pyramidal layer, and polymorphic. Different by cortex of the brain. Brain contains 6 layers. Hippocampus, 3 layers. Outer, molecular, intermediate, pyramidal, and deep layer of the hippocampus, polymorphic cell. Okay, contains 3 layers. This is heterotypic. Hemotypic contains any layer. Hemotypic 6. Heterotypic 3. Different between of the hemo and hetero. Pyramidal neuron. This one, this is pyramidal neuron. Pyramidal neuron. Mortality neuron. Pyramidal. Basket neuron. Pisiform neuron. Pyramidal and pisiform. Histological.
Hippocampus is heterotypic, right?
Yes.
And what is homotypic? The brain, the rest of the brain?
Yes. Hippocampus, the heterotypic and dentate gyrus. And visual area.
That's you.
Okay, primary motor area or precentral gyrus corresponding the level of the 4 Brodmann, premotor 6 Brodmann, frontal eye field area 8 Brodmann, Broca 44 and 5, okay, and primary auditory area 41 and 42, auditory association area 42, primary gustatory area, what's the meaning gustatory? Okay, and 43, one primary sensory area 1, 2, 3, okay, and primary visual, and 18 and 19 association visual area, all of
What
part.
about the vernix area?
Which one?
Vernix area.
Vertex area, thinking part of the brain, okay, thinking part of the area, 20, 30, 34, and 5. Disorder of association cortex, anoxia, apraxia. What's the meaning disorder?
Abnormality.
Injury disorder, okay, اختلال, and trauma disorder. Persian فارسی هم بلد؟
بله.
Broca, Wernicke, very high scientist, Wernicke and Broca. Nobel. Okay, and basal ganglia. Basal ganglia contains any nucleus, basal ganglia. Corpus striatum from caudate nucleus and lentiform. Caudate nucleus. Basal ganglia contains any nucleus. Caudate nucleus, lentiform nucleus, claustrum, and amygdaloid nucleus or body. And the corpus striatum formation from caudate nucleus and lentiform. Lentiform nucleus contains 2 parts, putamen and globus pallidus. Contains 2 parts, putamen and globus pallidus. Putamen and globus pallidus. Globus pallidus. Globus pallidus. 2 part, lentiform nucleus. Caudate nucleus and lentiform nucleus formation of corpus callosum. Okay, striatum. Corpus, thank you, corpus striatum. Corpus striatum. Globus corpus striatum and putamen, globus pallidus and putamen. 2 part, very important part is nucleus, lentiform nucleus, 2 part. lentiform nucleus to putamen, globus pallidus, caudate, and amygdaloid. Okay? Caudate nucleus and another nucleus, accumbens nucleus, not important. Sometimes this nucleus, accumbens nucleus, location of the septal area. Location from septal area. Globus pallidus, another name halo globus pallidus or haloestratium. Globus pallidus, formation of haloestratium. Globus pallidus, haloestratium, and putamen by caudate. 1, 2, caudate and putamen, formation of neoestratium or caudate nucleus and putamen, formation of neoestratium or stratium. Neoestratium or steratium, formation from which nucleus? Caudate and putamen. But just globus pallidus, formation from or pallidum or pallidum or pallidum. Pallidum just formation from
globus pallidus.
Okay, globus pallidus or stratium formation from
Putamen and caudate.
corpus stratium formation from okay, very important. All that part questions of final exam.
Can we take 10 minutes rest?
Okay. Corpus stratium formation from caudate and lentiform stratium formation from caudate nucleus. Stratium or neostratium formation from caudate nucleus and putamen, but pallidum or haloestratium just formation from and substantia nigra, subthalamic nucleus, ventral stratium and ventral pallidum, not important, stratium or caudate nucleus, formation from 3 parts, head, corpus, tail, and body. Head, corpus, tail. Pallidum. Which nucleus formation of pallidum?
Globus pallidus.
Thank you. Another name of corpus callosum? Another name of pallidum? Okay, very good. Basal ganglia components from okay, rest and continuous rest, continue of limbic system and this part. Limbic system and afferent are different pathway of the basal ganglia.